If you have ever been in a moment where things were going well, where you felt close to someone and everything seemed to be building toward intimacy, and then suddenly your body just did not cooperate the way you expected it to, you already know how disorienting that feeling can be, because one moment you are fully present, your mind is engaged, your attraction is real, and then the next moment your body seems to have a mind of its own, and the harder you try to force it back, the more elusive it becomes. And that spiral of worry can turn a small hiccup into a much bigger source of stress. Not just in that moment, but in every intimate moment that follows. Because once the mind starts anticipating failure, it becomes much easier for that pattern to repeat itself. And this is something that affects far more people than most are willing to admit out loud. Because there is a quiet kind of shame that surrounds this topic. A sense that talking about it means something is fundamentally wrong. When in reality, this is an incredibly common experience tied to biology, stress, and the nervous system rather than to a person's worth or masculinity. And understanding that distinction is often the first step toward addressing it in a calm and practical way rather than a panicked one. So let's talk through this together in a clear, respectful, and evidence-informed way. Starting with what is actually happening in the body during these moments, and then moving into a simple technique that many people have found genuinely useful when the issue is occasional and mild, rather than a sign of a deeper medical condition. Because it is important to be upfront that this kind of guidance is not a substitute for medical care. And if difficulties with arousal or firmness are happening consistently, or if there are underlying conditions such as diabetes, cardiovascular disease, low testosterone, certain medications, or other chronic health concerns, the right first step is always a conversation with a licensed healthcare provider who can properly evaluate what is going on and rule out or address any underlying causes. Because occasional physical responses like this can sometimes be an early signal of broader health patterns worth paying attention to. And self-directed techniques are not meant to replace that kind of proper evaluation, but rather to serve as a helpful tool for the more common, situational version of this experience, the kind that shows up when someone is nervous, distracted, tired, stressed about performance itself, or simply caught in their own head at the wrong moment. And if that sounds like the more familiar scenario, then what follows may be genuinely useful. So let's start with the basics of how this part of the body actually works. Because understanding the mechanism makes the technique make a lot more sense, and also takes some of the mystery and anxiety out of the situation. Since firmness in this context is fundamentally about blood flow, specifically about a sufficient volume of blood entering the tissue, and then, just as importantly, staying there long enough to maintain that response. And two major systems in the body control this process, the first being the autonomic nervous system, which operates largely outside of conscious control and switches between two very different modes depending on what the brain perceives is happening around it. One mode being the sympathetic branch, commonly known as the fight or flight response, which the body activates during moments of stress, danger, anxiety, self-consciousness, or performance pressure. And when this branch is dominant, blood vessels throughout the body, including the ones responsible for arousal, tend to constrict rather than relax. Because from an evolutionary standpoint, the body is prioritizing alertness and readiness to react over relaxation and intimacy, which makes a great deal of sense when you consider that arousal and vulnerability are, biologically speaking, the opposite of a defensive state. And the second mode is the parasympathetic branch, sometimes called the rest and digest system. And this is the branch that needs to be active, or at least more dominant, for blood vessels to open up, relax, and allow blood to flow more freely into the tissue that needs it. So in a very real sense, the nervous system acts like a gatekeeper. And if that gatekeeper is stuck in alert mode because of stress or anxious thoughts, no amount of mental willpower alone is going to force the body to comply, because this is not a conscious process. It is an automatic one, which is exactly why simply telling yourself to relax rarely works in the moment. And this is where the second major system comes into play. The muscular component, specifically the pelvic floor muscles, which form a supportive base at the bottom of the pelvis and play a much bigger role in this process than most people realize. Because certain muscles within that group act almost like a natural pump, and when they contract, they help push and trap blood within the erectile tissue, essentially reinforcing and maintaining firmness once blood has already begun to flow into the area. So you can think of these two systems working together like this. The nervous system is responsible for opening the door and allowing blood in, while the pelvic floor muscles are responsible for helping to hold that door open and keep the blood where it needs to be. And when either system is compromised, whether by stress shutting down the nervous system side or by weak or tense pelvic floor muscles failing to support the mechanical side, the result can be the same frustrating experience of losing firmness at an inconvenient moment. And this dual understanding is exactly why a technique that addresses both systems at once tends to be more effective than one that only addresses a single piece of the puzzle. Which brings us to the practical method itself. A simple combination of a specific breathing pattern paired with a pelvic floor contraction, designed to calm the nervous system and mechanically support blood flow at the same time. And the reason breathing is such a powerful tool here is that it is one of the only automatic bodily processes that can also be consciously controlled, which makes it a kind of bridge between the voluntary and involuntary nervous systems. And by deliberately slowing and deepening the breath, particularly by extending the exhale, it is possible to send a direct signal to the nervous system that the body is safe, which encourages a shift away from the stress response and toward the more relaxed state that supports healthy blood flow. And there is also a physiological detail worth mentioning here, which is that slow, deep breathing through the nose supports the body's natural production and circulation of nitric oxide, a molecule that plays a well-documented role in relaxing and widening blood vessels throughout the body, including those involved in arousal. And the nasal passages in particular are known to be an important site for this process, which is part of why breathing through the nose rather than the mouth during the inhale phase of this technique matters. So with that background in mind, here is how the technique actually works in practice, broken down into simple, repeatable steps that can be done quietly and discreetly without drawing attention, which makes it practical for real situations rather than something that only works in theory. Starting with the first step, which is to inhale slowly and deeply through the nose over a count of about 4 seconds, focusing on breathing into the belly rather than the chest, which means allowing the stomach to expand outward as the breath fills the lower part of the lungs rather than raising the shoulders. Because this kind of deep diaphragmatic breathing is far more effective at activating the relaxation response than shallow chest breathing. And it also helps draw attention inward and away from anxious thoughts, which on its own can begin to interrupt the cycle of worry that often makes the situation worse. Moving on to the second step, which is a brief pause, holding that breath gently for about 2 seconds, not with strain or tension, but simply allowing a short moment of stillness before releasing, giving the body a moment to register the oxygen and settle slightly before continuing. And then the third step is the longer and arguably most important part of the breathing pattern, which is a slow, controlled exhale through the mouth lasting somewhere between 6 and 8 seconds. And this extended exhale is significant because it is during this longer release that the nervous system receives the strongest cue to shift out of a stressed state and into a relaxed one. And this is also the point where the fourth step comes in, which is to layer in the physical component of the technique, engaging the pelvic floor muscles at the same time as the exhale. And the easiest way to identify these specific muscles is to think about the sensation of trying to stop the flow of urine midstream, or to imagine gently lifting and drawing upward from the base of the pelvis. And once that muscle group has been identified, the goal during this step is to contract and hold that lift for the same 6 to 8 seconds as the exhale, keeping the contraction focused and controlled rather than involving the entire body, since the aim is a precise, targeted squeeze rather than a generalized full-body clench. And then the fifth step is simply to release, allowing the pelvic floor to fully relax and letting the whole body soften for a moment before beginning the next cycle. And the sixth and final step is repetition, running through this full breathing and squeezing cycle somewhere between 3 and 5 times in a row, with each complete cycle taking roughly 10 to 15 seconds from start to finish, which means the entire sequence of 5 cycles can typically be completed in a little over a minute, making it something that can realistically be done in the moment without disrupting the flow of intimacy or drawing unwanted attention. And when this cycle is repeated a few times in sequence, the combined effect tends to build gradually, with the breathing calming the nervous system and encouraging blood vessels to relax and open. While the muscular contractions help pump and reinforce blood flow into the tissue that needs it, and many people report noticing a shift by the end of the 4th or 5th cycle, though the exact response will naturally vary from person to person and situation to situation. And it is worth setting realistic expectations here, because this is not a guaranteed fix in every circumstance, but rather a tool that has helped many people manage the kind of occasional stress-related response described earlier. And for anyone who wants to enhance the effect further, there are a few additional strategies worth mentioning, one being brief physical movement, since a short burst of activity like a set of squats or push-ups can help increase overall blood flow and circulation throughout the body, which may complement the breathing and squeezing technique nicely, particularly if there is a natural opportunity to step away for a moment beforehand. Though this obviously depends heavily on the situation and is more of an optional addition than a core part of the method. And beyond the technique itself, it is worth touching on some broader lifestyle factors that influence this area of health over the longer term. Because while the breathing and squeezing method is designed for in-the-moment situational support, sustainable improvement often comes from a combination of habits practiced consistently over time, starting with regular physical activity. Since cardiovascular exercise in particular supports healthy blood vessel function and circulation throughout the entire body, which naturally extends to the tissues involved in arousal, and strength training, including exercises that engage the pelvic floor and core, can help build the underlying muscular support that makes techniques like the one described here more effective when they are needed. And alongside physical activity, sleep quality plays a surprisingly large role in this area of health. Because poor or insufficient sleep disrupts hormone regulation, increases stress hormone levels, and reduces the body's overall capacity to shift into a relaxed, parasympathetic state, all of which can make occasional difficulties more frequent. So prioritizing consistent, quality sleep is far from a minor detail and should be considered a foundational piece of overall function in this area, and closely related to sleep is stress management more broadly, because chronic ongoing stress keeps the nervous system biased toward that fight or flight state described earlier, making it harder for the body to relax even in situations where relaxation would otherwise come naturally. So incorporating regular stress reduction practices into daily life, whether that is through structured breathing exercises like the one outlined here, mindfulness practices, regular movement, spending time outdoors, or simply making space for activities that feel restorative, can have a meaningful cumulative effect over time, and nutrition is another piece of this puzzle worth acknowledging, since a diet that supports healthy blood vessel function and circulation, generally one rich in vegetables, healthy fats, lean proteins, and foods that support nitric oxide production, tends to support this area of health as part of a broader pattern of cardiovascular wellness. Though it is worth being cautious about any single food or supplement being framed as a dramatic fix on its own, since the reality is almost always more nuanced and tied to overall patterns rather than isolated choices. And similarly, reducing or moderating alcohol intake and avoiding tobacco use are both well-established factors that support healthy circulation and nervous system function over time. And while none of these lifestyle factors offer the kind of immediate, in-the-moment support that the breathing and pelvic floor technique provides, together they create the underlying physiological environment in which that kind of technique is more likely to be effective when it is needed. And it is also worth taking a moment to address the emotional and psychological side of this experience directly, because the anxiety that often follows one difficult moment can become just as significant a factor as the original physical response itself, since worry about it happening again can create a kind of self-fulfilling cycle, where anticipation of failure keeps the nervous system in that alert, sympathetic state precisely at the moments when relaxation is needed most. So part of addressing this well is learning to approach these situations with a sense of calm rather than panic, recognizing that an occasional difficulty is a normal physiological response rather than a personal failure, and reframing the moment as something manageable rather than catastrophic can itself reduce the anxiety that so often makes the situation worse. And having a concrete tool like the breathing and squeezing technique can help in this regard as well. Not only because of its direct physiological effects, but because having something practical to do in the moment, rather than simply spiraling into worried thoughts, can itself interrupt the anxiety cycle and restore a sense of control. And this is part of why practicing the technique in a low-pressure setting beforehand, on its own, outside of an intimate moment, can be genuinely useful. Since becoming familiar and comfortable with the breathing pattern and the muscle engagement ahead of time means it becomes much easier to execute smoothly and naturally in the moment when it is actually needed, rather than trying to learn something new while already feeling stressed. And this kind of practice also helps build a stronger mind-to-body connectivity.